the different parts of the hand come to the cubital and then to the axillary. Do you remember axillary cavity? How many walls it has? 4. In accordance with this wall, we have anterior group, posterior group, lateral, medial, and also the central and apical group of lymph nodes. And outflow into this group from upper limb, superficial and deep. But not only from the upper limb is outflow into the axillary. Remember, it is very important also from the mammary gland. For female, it is very important for cancer of mammary gland. From the mammary gland, it can be divided in 4 quadrants. 4 quadrants we can divide: superior medial, inferior medial, superior lateral, inferior lateral. From the lateral quadrants of the mammary gland, lymph is outflow into the axillary cavity. That is why mammolog specialist of the mammary gland during examination can raise your hand and check this lymph nodes in axillary cavity. From the medial part is outflow into the parasternal. Here we have sternum. From inside, on both sides of the sternum, we have parietal parasternal lymph nodes. And from axillary group of lymph nodes, you can see lymph is outflow into the subclavian and then into the cervical group. The lateral, deep, cervical lymph nodes. Nodi lymphatici lateralis cervicalis profundis, outflow here. Turn your attention, we have question of the MCQ. Into what lymph nodes is outflow from mammary gland? You must write all 4 answers, remember this. Cervical lymph nodes, axillary lymph nodes, parasternal, all. You understand? Upper limb. Now head and neck. Lymph nodes of the head and neck. This is border between head and neck. Yeah? How it passes? Protuberantia occipitalis externa, linea nuchus superior, base of the mastoid process, angulus mandibulae, base of mandible, and chin protuberance of the mandible, protuberantia mentalis. The chin, this protuberance. From occipital protuberance, through the mastoid process, through the ankle base. This is upper border of the neck, and this is lower border of the neck. Yes. Along this border between head and neck, we have localization of the main lymph nodes of the head. What group of lymph nodes? Occipital, mastoid, parotid, submandibular, submental. Yes. Lymph nodes of the head region. And in accordance with what region inflammation, for example, wound is occipital region. What group of lymph nodes? Inflamed, increased, occipital. This region, for example, the zygomatic region around the orbital, outflow into the parotid. From the teeth, tongue, lips is outflow. The largest group, main group, is submandibular. As a result of the lymph is outflow mainly into this group, submandibular group of lymph nodes. From middle part, herpes, for example, middle part of inferior lip, into what group will outflow lymph? Submental. Herpes of the lateral part, submandibular. From the apex of the tongue, inflammation, what group of lymph nodes will be increased? Apex of the tongue, submental. From the corpus, dorsum, root, submandibular, and maybe retropharyngeal group of the lymph nodes. And turn your attention on the neck. We have along the jugular vein, internal jugular, the largest main group of the lymph nodes. Nodi lymphatici, lateralis, cervicalis, profundi. Nodi lymphatici, cervicalis, lateralis, superficialis we have, and profundi. The deep are located along the vena jugularis interna. Superficial, they are located along the anterior and external jugular vein, more superficially. This is group of the deep. among this deep, you must distinguish group of lymph nodes which are located on cross-section of digastricus muscle and vena jugularis interna, and omohyoid muscle and vena jugularis interna. One of nodes is called nodus jugulo-omohyoideus, another is jugulo-digastricus. They are specific for cancer of the tongue. These lymph nodes, two group of lymph nodes, become increased in cancer of the tongue. On section of the jugular vein with digastricus and jugular vein with omohyoid muscle. Thus on the neck we have superficial and deep. Yeah? Like upper limb, like lower limb, part of the body, neck, superficial, and here also we have superficial and deep. Lymph is outflow mainly from head and neck into this largest group of lymph nodes, which are located along the vena jugularis interna, and they are called nodi lymphatici cervicalis lateralis profunda. From these lymph nodes is outflow into what trunk? Truncus jugularis dextra and sinistra. Dextra and sinistra. From upper limb, lymph is outflow through the truncus subclavius. Thus, in right and left angle are drained two trunk. What trunk? From right half, truncus jugularis dextra, head and neck. From right upper limb, truncus subclavius dextra. And from thoracic cavity, ductus thoracicus dexter, ductus lymphaticus dexter. One duct and two trunks drain here. On left side, what trunks, what duct? Thoracic duct on left side and two trunks. From left half head and neck, truncus jugularis sinistra. From left upper limb, truncus subclavius sinistra. Two trunks and one duct brings lymph into the venous stream. Return the lymph into the venous stream. This is lymphatic system now shortly. You understand? Lymphatic system, main parts, and their structure and their function. Bring into the venous angle. You can shortly draw the angles, schematically draw these angles. Two angles. Draw the truncus subclavius dexter, truncus jugularis dexter, and truncus here. From upper limb comes this, this, and this. And from left half comes truncus jugularis sinister, truncus subclavius sinister, and thoracic duct. One duct, two trunks. Each side are open. But the main part of the lymph, 3/4 part of the body, 3/4, from lower limbs, from pelvic, abdominal cavities, left half of the thoracic cavity, left half of the head and neck and left upper limb, lymph is outflow in left venous angle. Only from 1/4 part, right half of thoracic cavity, right upper limb, right half of the head and neck. Drain into the right venous angle. 1/4 in this part is outflow, and all this is outflow into the left. Understand? So, and now in the museum we'll demonstrate this lymphatic system and immune system organs.